Hi, everyone. My name is Katie Brumfield, and I'm the Colorado School of Public Health Career Services Specialist. And today I am talking with Kristine Burrows. Kristine graduated from our school in 2018 with her master's in public health in leadership and public health practice. Hi, Kristine.
Katie, thanks for having me.
Yeah, thanks for joining. And I'm so glad we're matching.
Striped girls today.
Yeah. Kristine, could you just start off by telling us what's your current job title and where do you work?
Sure, I'm the Director of Aging, Care, and Connections at Jewish Family Service, and we are a nonprofit, non-sectarian human services organization. And so my job is to oversee any programs or services for folks 60 plus.
Oh, nice. And can you describe what a typical day? I know a typical day is kind of a loaded question, but or big projects you work on, but kind of like what's your tasks?
Yeah, a typical day doesn't really exist, admittedly, but my role is to work on strategic planning. So making sure that we are thinking about the future of aging and future of older adults and how we can better improve our service delivery models. It might include budgeting, grant preparation, meeting with community partners and stakeholders and our clients to make sure that our services are doing what they're supposed to be doing, evaluation, data management, etc. All of the above.
And could you tell us what your career path has been to get you to this director role?
Yeah, I have always been interested in aging and older adults, and admittedly, for a very long time, I thought I wanted to go into physical therapy. And so I went, I was working in a physical therapy clinic for older adults, and I was getting ready to put in my application to CU, their School of Physical Therapy. And as I was working in the clinic, I realized that there were a lot bigger, broader issues that I was really more interested in than that one-on-one connection with older adults. And while I do love that one-on-one connection, we had clients who were coming in who, with their explanation of benefits, and they couldn't read it and they needed help with that. And that was really frustrating to me that, they couldn't read their insurance information. And we'd have folks who would have an injurious fall and they couldn't get in to see their primary care doctor in a week. And so that access to healthcare was really frustrating to me. And I was teaching a strength class I had about 20 folks in this strength and exercise class. And for the most part, everybody in the class hated exercising. They did not want to come to exercise class, but everyone came 3 days a week early, and everyone was great friends. It was such a great time to be in community. And I loved the class and the people that were in the class. I was so frustrated that they felt like they needed to do something that they didn't like. I mean, granted, we all need to exercise and work on our strength, but they were coming in this class that they hated just because there was a community aspect and they had friends involved. And so I wanted to be able to find a platform to change broader health access and community access. And so that's where I went into the public health space instead.
How did you find public health?
I was working, so I kind of transitioned outside of working in a physical therapy clinic, and I was working on the Anschutz campus in a lab. And I was trying to think about all the tuition credit that you get as an employee. And I was looking at classes and I was like, wait a minute, public health kind of checks all of these boxes on advocacy and community engagement that I want, and that, to make that broad change. And so I took the leap and went for my MPH.
Did you work while you were a student?
I did. I went to school full time and worked full time, which was great. The leadership and public health practice degree is all online, so it was really, really flexible for me to be able to work, my 40 hours a week and then do class online afterwards, asynchronously.
I get that question a lot from people. Can I work full time while I get my degree? And I agree with you that leadership degree makes it very, very accessible.
Yeah, I mean, it's hard. It's a lot of time, a lot of hours. It was not an easy couple of years, but certainly worth it.
Yeah. How many years did it take you to go through the program?
It took me 2.5 years.
Oh, okay. That's pretty quickly. Usually I feel like it takes about 3 with people working full time, but
yeah, it was hard, but totally worth it.
Yeah. And how would you say the Colorado School of Public Health helped prepare you for this role?
The thing I really liked about the School of Public Health is the engagement with community. And so in my role, it's my job to make sure that we're providing services and programming that the community needs and that the community wants. And so being able to do those evaluation techniques and assess the community need for what's out there and what needs to be out there is really, really critical. You know, I have 1,000 ideas about what kind of programming I want to implement in the community, but if older adults don't want that or are not going to access it, then it's totally not effective. So I really have appreciated that aspect of the School of Public Health and community engagement.
Yeah, that's really, really important. And how long have you been in this role?
I've been in this role for about 1.5 years now.
Oh, nice. And have you faced any challenges in this role that you want to tell us about?
Yes. Well, I'm sure everyone says COVID at this point.
Yeah, that's a common
but one of the things that kind of COVID aside, one of the things that is sort of one of my main challenges is trying to figure out how to engage the entire community. So JFS is a human services organization, and for the most part, we provide basic needs support. So food insecurity, housing, like care management and medical navigation, things like that. But there's a lot of people, and COVID has highlighted this, that are really struggling with social isolation. So trying to figure out how we can engage the older adults in our community who don't need assistance with basic needs support, but maybe need assistance with engaging in community or that civic engagement, or people who've been working, who've been in the workforce for 40, 50 years and have retired, and now they have 40 or 50 hours a week that they, of time that they didn't have prior. And so trying to figure out how to balance, figure out how people can balance that and engage in community and decrease the stigma. We have a lot of ageist stigma around aging and older adults. And so the thing I get a lot is, I'm too embarrassed to go to a senior center, or I would never, why are you embarrassed to go to a senior center? What is the stigma there? So that's my big challenge, is decreasing ageism and making sure that we can engage the entire older adult community.
Yeah. What about a success story or something that you're really proud of that you've been able to achieve in this role?
Yeah, along the same lines of what I was talking about with what the School of Public Health has taught me, engaging in community is so important. And so one of the things that has been really critical to me and my team is that we leave a little bit of capacity in all of our time to respond to community needs quickly. So pretty much at any given time, we have some sort of community response program going on. So when vaccines rolled out, we did a huge vaccine campaign with our clients in the community. We hosted a vaccine site and made sure that our clients had access to education and knew how to get to the vaccine site or knew how to access a vaccine when it was their turn.
Yeah.
We did a big voting campaign last year. So making sure that people were registered to vote. And we had one woman who was in her 80s and she's deaf. And she had never registered to vote in her entire life. She'd stood in line a couple times and the line was too long and she just sort of ran out of time. And so we were able to help her register to vote, and she voted for the first time in the 2020 election at the age of 86. So yeah.
Wow, that's so cool.
Yeah. So just things like that we can help the community immediately. Like that was an immediate need, and we were able to jump in and help out. So
that's super cool. I love that.
Yeah, it was great.
Yeah. And I guess I didn't even think about vaccine, but yeah, getting, it almost feels like you have to kind of adjust according to what's going on to make things accessible for the older community.
Yeah. Making sure that people had transportation to get to the vaccine site, making sure that people had education about the vaccine and when they're eligible. And there was so much up in the air about when you could go in for your vaccine and who was eligible and if it was safe. And so we just did a ton of work around making sure that people knew the vaccine is safe, it's effective, and this is where you can get it, and this is how to sign up.
Yeah, I can imagine your public health degree really came in to play there.
Oh yeah.
What advice would you give to someone that is interested in working with this population or pursuing a leadership role like yourself?
Be bold. Like ask I think in the last 5 years, well, since I started my MPH, I think I've probably done like 100 informational interviews, like cold email, cold call find people who are in the position that you want and reach out for an informational interview or reach out for coffee or something, ask questions about how people got in their roles, find them on LinkedIn. Apply for the jobs that you don't think you're qualified for, apply for the board positions, be really bold. It has paid off for me. And, I think I've been able to create a really impressive network of people in the public health space and the aging space. And I think that's been really helpful for not only me, but being able to recommend other people as well.
Yeah, I really like that advice. Be bold. That's really,
Thanks.
really good advice. Yeah, because a lot of times people say, I don't know if I should apply for this job. I don't meet every qualification, but they absolutely should.
Yeah. Yeah. It's likely that maybe that qualification is not the highest priority and that there are learning opportunities once you get into the job. So
Yeah.
Don't pull yourself out of the running right away. Let somebody else pull you out if you truly aren't qualified.
Yeah, that's true.
Yeah.
Well, thank you so much, Kristine, for sharing your career path with us and what you do. And thank you for all the amazing work you're doing in public health.
Yeah. Thanks so much, Katie, for having me. It was great to talk to you.
Yeah. Have a good day.